Hi, I'm Helen. I'm talking to Sam today. Sam is a GP in Wellington, and she is also a talented artist and has written this and illustrated this book on minor surgery. Sam, can you tell us a little bit about your book first of all?
Okay. Well, I wrote it because I had taught minor surgery for a long time, and I'd been in the plastic surgical unit for 14 years doing their minor surgery clinic, and so a lot of the skills that I use there I take into my general practice, and then I sort of got tired of repeating myself, so I decided that I'd write the book, and I wrote it all up, and then had one of the plastic surgeons in Wellington look through it, and we've just expanded it to meet all the things that he and I would expect GPs to be able to do, and also people who may want to extend their skills a little, but it starts from absolutely at the beginning, like, hello, I'm talking to a patient, and getting a consent form, to what you have on your trolley, to the process that you go through. And then the reason I illustrated it was because I wanted to get pictures that I wanted to demonstrate a specific thing, and a photograph doesn't normally do that. Exactly, you have to be careful with that, but it was fun, and I took over a whole bedroom in the house to do all the paintings, and that was good. Yeah.
And so it sounds like it's really good for someone who's a GP who wants to start trying to do some small minor surgery in their practice. It'll be a good kind of Bible for them to have. And also for medical students, maybe learning this kind of thing as well.
So some of my medical students, I'll have them in my practice, and we'll give them pigskin and just say, here's the book, and give them, they sit there for an hour and a half, and by the end of it their stitching's beautiful. And it talks about the little things that are the dumb stuff that annoy you when you first start. So your needle goes flat, and your sutures don't look even, and it's all those little things. So
I think we read before, don't bend the needle, which is the key, which we all do.
And even some of my colleagues who've been doing surgery for a while will pick it up and just have a quick read through before they do something that sort of they haven't done for a few weeks or months.
Just that reassurance if you're not doing it every day. So you're clearly a very talented artist, and I understand you do art outside of medicine as well, but I know that you do art in your consults, you draw for your patients. Can you tell me a little bit about how you use it?
I think it started for me because I was talking to a patient about how blood pressure works, and as soon as I started talking, he just said, oh, that's way over my head, and I was like, well, I was talking about a hose and squeezing it, so it sort of got frustrating, and so then I started to draw pictures of some of the simple and basic things, but then I draw a lot, so it's sort of probably got more complex in what I draw. So if someone was having hip surgery, I'd draw up a picture for them about what they were going to be doing, and I think it changes the consult so that they can start to ask questions. It brings it down to a level of simplicity, which often medical terms are really complex. So you start to use like little terms that they understand, like here's your stomach and your appendix is down here and that matches here, so people know what you're talking about.
So it's a tool for engaging with people as well as actually showing them what's going to happen or what is going on.
And if they understand better, then they will take their medication more reliably, or they'll know why they're taking their medication, or things like that.
So can you show us, have you got an example of a case that you've used recently? I think you mentioned a thyroid one.
So I had a lady in the other day, and her thyroid blood tests were a little bit different from what I'd expect them to be, and she was on regular medication. So sometimes you see results and you sort of go, well, is it because they haven't taken their medicine or because they're not having enough? So I said to her, well, here's your brain, and that sends out some stuff called thyroid stimulating hormone, which makes your thyroid work. And so your thyroid's down in your neck. So here's head, neck for you. And it will send that down to your thyroid, and your thyroid produces T4. Now, for her, she was having this as a pill. So that's your pill that you're taking. And in our bodies, your bloodstream goes around everywhere, but that T4 goes past your pituitary gland up in your brain and sends out a signal to say you need more TSH. So I said to her, well, yours here has gone up because you're not getting enough of this. And so she says, oh, and it made total sense for her. And so she knew that we needed to up her dose. And we weren't just making it up.
It wasn't just hearing the words, it was hearing it and seeing it. Identifying it with it in a different way. And you also mentioned a bone marrow. Now I am really interested in this, because how do you explain bone marrow failure in a picture?
So my other lady, she had some abnormal blood tests, and I'd never met her before. And so we're talking about the abnormalities, and then and she's looking a little bit yellow, and so, but her liver function was completely normal. So I said to her, well, look, here's your liver, and it processes a whole lot of things, and one of them is your red cells, and if they're not working particularly well, then it produces a whole lot of, they get broken down faster, so that's why your bilirubin goes up. And everything else, your liver's working okay, but it's making lots of the stuff. And looking at your blood count, your blood's sort of made in your bone to a certain extent. That's what bone marrow is. And so you make these red cells, and your platelets come from here, and your white cells come from here, and so all of those are failing. And so she could get it, that, you know, this is the part that wasn't working, and that her liver was actually just busy, and the reason she was going yellow was because of this. And so it was just a sequence of events for her that made it make sense, rather than I need to be stabbed because my blood count's down, and I've gone yellow, and it all made no sense.
Do you think we all should be trying to do this, even if we're not particularly artistically
inclined? I mean, this is not an art form. I think if someone's looking at you blankly or just nodding all the time, you need to find some other way of explaining things to them. And often we'll give out pamphlets and stuff, but actually this personal interaction is really important. And so I'm looking at doing some research into this starting in July this year, and finding practitioners who draw and see what goes on, and then talking with their patients about how they feel about it and what their outcomes are and whether there's a difference.
That sounds fantastic. Sam, thank you very much for talking to me.